Welcome back. You're watching SA Today with me, Unati Bagyasha. Let's turn our focus here now. The South African National Blood Service earlier this month launched an awareness campaign that aims to increase blood donations ahead of the holiday season. Let's discuss this. We are now joined by Dr. Karen van den Berg from the South African National Blood Service. Doctor, thank you so much for your time this afternoon. Now, it is the festive season. This is the time when you do call out for more people to donate blood. Perhaps paint a picture for us what the current situation is looking like. What is the current blood stock levels at the moment, as an example?
At the moment, we are actually quite desperate because our blood stock levels is now sitting at 2.4 days, which is, well below the 5-day target that the WHO recommends for us to be able to have a safe and sustainable blood supply. So we are on the verge of having to start cutbacks to our patients. This causes problems, especially for our rural area hospitals. So we are actually in real dire straits at the moment.
Now, what is the impact of that? If you are sitting at levels of 2.4 days, as an example, when you actually need 5, what blood types are we talking about, and what are the implications that you're seeing real time in hospitals?
So our biggest shortage is of Group O blood donors because those are the blood groups that we can use for virtually any patient. And having such low blood stock levels means that we unfortunately will have to start when doctors are ordering maybe 2 units of blood, we will only be able to give them 1 unit. Under very dire circumstances, the really rural hospitals where they have only emergency blood fridges, we may not be able to replenish the stock for those hospitals. And in general, it may mean that when people have to go for elective surgery, it may need to be postponed because there isn't sufficient blood should they need some. And very distressing to us is that for our obstetric patients, for the mothers giving birth, if they were to have sudden severe bleeding, we may not be able to provide sufficiently for them. And that, of course, is an absolute travesty for any society to have to lose a mother during childbirth. And even for our cancer patients, we simply may not have enough blood to be able to provide to them.
Now, somebody was actually made a mention, in passing to me, saying it seems like the South African National Blood Service is always in a dire situation, always in need of blood. Why is that? I mean, I know that 1% of South Africans are active blood donors. Where do you think the problem lies?
So we went through, just before COVID, we had actually changed our model, our collections model, and we were, for that whole year, we were doing really well. We never had any real shortages. But then COVID happened. And so at the moment, we don't even have 1% of the population donating. In fact, our blood donor pool has shrunk by more than 20%. So we've essentially lost 1 out of 5, 1 out of every 4 donors over the past 18 months. We haven't been able to revitalize our donor pool because we have had extremely limited access to, for example, schools and universities. And moreover, even our traditional, really great places where we were able to collect large volumes of blood, such as large, banking campuses and so forth, we either have very limited access. And this is then further compounded by the fact that many people work from home. And so we simply have been unable over the past 18 months to really get to our donors. And so we have been really having to find creative ways to address this problem. But then this has now been further exacerbated by the fact that with the current Omicron wave, so many of our staff are also affected. They also live within the normal situation of South Africa. And so just as other South Africans are affected by COVID, we have had to place a large number of our staff either in isolation or in quarantine, as protecting our donors is a key priority for SABC. All of this has conspired to us really struggling at the moment.
And my next question was going to be what the impact of COVID-19 has been on the National Blood Service, and it does seem like it is taking a major toll. 1 out of 5 donors that you have lost in the past 18 months, you say. So one would imagine, though, that this service is one that is essential. It is actually one that is very critical. So in your discussions about just what are the initiatives that you need to take on board, I mean, is there some level of prioritization from the health department, as an example, or even from a national government?
So the departments of health are some of our key stakeholders, and we are working with them to ensure that we are able to provide for a sufficient and safe blood supply. But it is really hard. The traditional way of doing our business has to change. We have already started. We have commissioned really state-of-the-art vehicles that we can drive up to, for example, housing estates, so that we can go and collect blood where our donors are. And so we have been creating adapting to our new normal. But with each wave, we unfortunately do struggle. And what has made it so much more difficult during this wave is that while our staff and our access to blood donors have reduced significantly, the actual usage of blood in the hospitals, which traditionally in the previous waves have gone down quite a lot, hasn't happened over this festive period. In fact, in some instances, it has actually gone up. And so even with all the great initiatives that we have taken, and with support from the Department of Health and so forth, we are still struggling. In Europe, people now go to holiday, and so donating blood is not their key priority. And so, this is just really a very strong appeal for people to know that we are in dire straits. I don't think that we've ever started, in the last couple of years at least, haven't started a festive period with such low blood stocks as we have at the moment.
Dr. van den Berg, the reality is, with these constraints, particularly that COVID-19 brings, and specifically this new variant, you're still encouraging people to donate blood. So what are some of the things that you would like people to consider, as they want to donate blood? Given the fact that the reality is some people are asymptomatic, some have just probably recovered from COVID-19. So what would you suggest if somebody is listening there, out there in terms of donating blood and they want to actually donate blood? What constraints, should they be operating under? What are some of the tips that you can give us?
So yes, I think most importantly is for me to mention that we accept blood donors whether they have been vaccinated or not. And so while we very strongly support the vaccination drive of the government, we do accept donations from both vaccinated and unvaccinated donors. You can come and donate the very next day after you've had your vaccine, as long as you are feeling fit and healthy. And then if you have any symptoms suggestive of COVID or have been exposed to somebody who had COVID, we would ask that you wait 10 days before you come and donate, 10 to 14 days. And then if you've had COVID, if you've been really very ill in hospital, 28 days after full recovery is the time for you to come and donate again. And if you've been just mildly ill or asymptomatic, 14 days after recovery, we do welcome everybody to come and donate. And from our side, SANBS has prioritized the safety of our donors right from the start. So our staff are well trained in all of the social distancing and IPC methods or infection prevention control methods. And we really do go all out to try and protect our donors when they come and donate.
All right, Dr. Karen van den Berg from the South African National Blood Service, thank you so much for your time this afternoon. Really do appreciate it.
Thank you.
The National Blood Service